Welcome! In this video about the protective barrier in brain injury, you'll learn the importance of viewing traumatic brain injury from a biological, psychological, and social perspective. You'll hear examples of how injury occurs to a person with a particular physical status, particular life experiences and coping style, and particular current relationships with individuals and organizations. Using case examples, we'll look at the specific components of the protective barrier that stand between the force of impact and the brain. As an internal medicine intern, I and other trainees evaluated a distraught artist suffering from shortness of breath and progressive walking problems. Noting a normal physical exam and a recent emotionally traumatic breakup with his lover, I quickly concluded that the symptoms were manifestations of a hysterical conversion reaction rather than caused by any physical problem. Well, what a shock I had the next morning as I walked into the hospital and observed a swarm of medical personnel rushing this poor man, barely able to breathe, to the intensive care unit to be placed on a ventilator. The diagnosis was polio. He was one of the few people who had not been vaccinated. The same year, I speculated that a man complaining of severe back pain and a stormy relationship with his son was symbolically expressing his disappointment, frustration, and anger with his son through the pain. That is, his son was metaphorically a pain in the back. Well, I changed my diagnosis, however, after seeing the bone spurs, probably pressing on nerves, and spinal imaging. These two cases are examples of a common pitfall to which we all fall prey at times. The wish to find clear-cut, simple, unambiguous answers to life's complex problems. At that time, I was so interested in the psychological factors and illness that I downplayed possible physical contributors. So it can be in the evaluation and treatment of brain injury. Pressured by constraints of time, money, and other resources, we may eagerly narrow the focus to one particular issue to explain complicated behavior. For example, depending on the perspective of the evaluator, a brain injury survivor's irritability may be attributed to one of these factors: frontal lobe bruising, neurotransmitter imbalance, inadequate sleep, poor nutrition, excessive or inadequate medication dose, relationship disappointments, lack of recreational and vocational outlets, loss of job, and so forth. Well, my point is that brain injury is best viewed from a biological, psychological, and social perspective. Injury occurs to a person with a particular physical status, particular life experiences and coping style, and particular current relationships with individuals and organizations. As a psychiatrist and psychoanalyst, I deal with emotional, behavioral, and cognitive problems of brain injury survivors and their families. Emotional problems include depression, anxiety, fears, irritability, anger, shame, guilt, and so forth. Behavioral difficulties include temper outbursts, sleep problems, poor initiation, passive resistance, impulsivity, wandering, sexual inappropriateness, and so on. And cognitive problems include poor judgment, forgetfulness, poor attention span, trouble with multiple tasks, planning, and organizational difficulties. I find it helpful to view the nature and severity of problems resulting from brain injury as determined by a protective barrier, as discussed by neuropsychologist Thomas K., Ph.D. This barrier is comprised of biological, psychological, and social factors. And it is the individual differences in the components of the protective barrier that explain why similar neurological insults produce inconsistent outcomes.